CNA Exam Success. Welcome to the quiz. Question 1. Adapting care approaches for patients with sensory impairments enhances safety and communication. When preparing to enter the room of Mrs. Lewis, a 92-year-old resident with severe macular degeneration and significant visual impairment, which approach represents best practice for entering her room and initiating interaction? Option A. Knock once and immediately begin speaking to alert her to your presence. Option B. Enter as quietly as possible to avoid startling her with sudden noise. Option C. Announce yourself clearly, identify objects you're moving, and describe your actions. Option D. Turn on all available lights to maximize illumination before approaching her. The answer is C. With visually impaired patients. Question 2. Performing range of motion exercises correctly helps maintain joint mobility and prevent contractures in patients with limited movement. During a training session on proper ROM techniques, the physical therapist emphasizes important principles for effective exercises. Which statement accurately describes correct practice for performing range of motion exercises with patients? Option A. Perform exercises quickly and efficiently to minimize patient discomfort and save time. Option B. Complete a full set of exercises for each major joint at least 3 times daily. Option C. Continue each motion until the patient complains of pain, then proceed slightly further. Option D. Reserve all range of motion exercises for physical therapy staff with specialized training. The answer is B. ROM exercises should be performed at least 3 times daily to maintain joint mobility and prevent stiffness and contractures. Quick exercises risk injury and don't provide adequate stretching. Exercises should stop at the point of resistance or discomfort. Question 3. Accurate pulse assessment requires understanding appropriate timing and technique variations. As you assess Mr. Johnson's radial pulse during routine vital signs, you consider the optimal timing method for obtaining an accurate resting pulse rate in a stable adult patient. When measuring radial pulse during routine assessment of a stable adult patient, for what duration should you typically count the pulse beats to ensure accuracy while considering clinical efficiency? Option A. Count for exactly 15 seconds and multiply by 4 to calculate beats per minute. Option B. Count for 30 seconds and multiply by 2 to determine the minute rate. Option C. Count for a full 60 seconds to obtain the most accurate measurement. Option D. Either counting for 30 seconds multiplied by 2 or 60 seconds is acceptable. The answer is D. Both 30-second and 60-second counting are acceptable for routine pulse assessment. 60 seconds provides greatest accuracy. Question 4. Proper technique when emptying urinary drainage bags prevents contamination and infection transmission. While emptying the catheter drainage bag for Mrs. Rodriguez, who has had an indwelling catheter for 5 days postoperatively, you must avoid specific actions that could introduce pathogens into the system. Which action should you carefully avoid during the drainage bag emptying procedure? Option A. Wearing clean gloves to protect yourself from potential exposure to urine. Option B. Allowing the drainage spout to touch the inside or rim of the collection container. Option C. Measuring the total output volume in a graduated collection container. Option D. Accurately recording the output amount in the patient's intake/output record. The answer is B. The drainage spout must never touch the collection container to prevent contamination. Contact introduces bacteria into the drainage system. Question 5. Recognizing signs of metabolic emergencies allows for timely intervention in patients with chronic conditions. While assisting Mr. Davis, a 58-year-old patient with type 1 diabetes, with his morning care, you notice he appears confused, is diaphoretic, sweaty, and reports feeling shaky and dizzy. Based on his presentation and medical history, what acute metabolic complication should you immediately suspect? Option A. Hyperglycemia, elevated blood sugar, requiring insulin administration. Option B, hypoglycemia, low blood sugar, requiring rapid carbohydrate administration. Option C, hypertensive crisis requiring immediate blood pressure medication. Option D, cerebrovascular accident, stroke, requiring neurological assessment. The answer is B. These symptoms indicate hypoglycemia, confusion. Question 6. Maintaining appropriate professional boundaries with patients preserves therapeutic relationships and prevents ethical violations. During a discussion about professional conduct, the charge nurse asks which scenario demonstrates proper maintenance of professional boundaries between a CNA and a patient. Which action appropriately demonstrates maintaining professional boundaries in the nurse-patient relationship? Option A. Accepting a small homemade gift from a long-term resident expressing gratitude. Option B. Sharing details of your recent personal relationship problems with a sympathetic patient. Option C. Using a patient's first name with their permission during care activities. Option D. Focusing care interactions on patient needs without discussing personal matters. The answer is D. Professional boundaries mean keeping the relationship therapeutic and patient-centered. Discussing personal matters blurs boundaries and shifts focus from patient needs. Small gifts may sometimes be acceptable per facility policy, but aren't the best example of boundary maintenance. Using first names with permission is acceptable if it respects patient preferences. The clearest boundary maintenance is keeping interactions focused on patient care without personal disclosure. Great job! Don't forget to subscribe. Bye!